Glaucoma is the silent thief of sight. Yes, it is. And you do not want to lose your vision. You or your loved ones don't want to lose your vision or your sight due to what? Glaucoma. Okay. Hi guys, welcome back to my channel. I am Dr. Onomowe Ufoma Juliet. I am your favorite optometrist. And it's World Glaucoma Week this week. Yeah, starting from on the 10th to the end of this week, right? Yes. So today we're going to be talking about what glaucoma is and how you can understand the meaning of glaucoma, how you can actually understand it and have an in-depth understanding or an in-depth comprehension of glaucoma and the issues that come with it. All right, so first off, do also subscribe to this channel, like this video, and share with your friends, share with your family members, because the information here is very important for everyone. Do want to listen to the last information that we're going to be giving, because it's going to be very essential for your eyes. First of all, I'm going to start with the definition of glaucoma. So what's glaucoma? I'll do well to explain to you the way I explain to my patients in the clinic so that they will be able to get and grasp everything they need to know about it. I'll use a lot of basic and ground level information so that you can actually get the message that I'm giving. I will try as much as my best to stay away from medical jargons, medical jargons, and the rest of it. So now listen to this phrase. Glaucoma is the silent thief of sight. So I want you to stay with me, okay, because we're going to be using that phrase all through our session today. Okay, now what is glaucoma? Glaucoma is a condition whereby there is a gradual, consistent depletion or loss of the optic nerve head. Stay with me, because it's gradual depletion, gradual death of the optic nerve head, which then causes permanent damage, permanent vision loss, permanent loss of one's vision. So while giving this definition, I talked about optic nerve. What is optic nerve? In order for us to see, there has to be this connection between our eyes and the brain. The eye doesn't work alone, it doesn't work on its own. Okay, so the eye cannot just sit on its own and say, oh, today let me go and rest, tomorrow I'll come back, or I'm tired of the brain, I'm tired of the body, I want to work on my own. No, it doesn't work like that. So the optic nerve is the stalk of nerves that connects the eyes to the brain. Okay, I'm going to use something now to illustrate that for you. For instance, let me use this. Okay, the flower. For instance, this is your eye, the stalk of flowers, the roses, this is your eye. And for instance, this white part is the brain. Stay with me. Now you have this white connection. There's this bridge here, this connection here, right? That connects this flower, these roses, to the brain. So this connection, this bridge is your optic nerve. It's everybody's optic nerve. Okay, so now glaucoma is the constant depletion, constant death of the stalk of nerves that connect the eyes to the brain. So imagine if these nerves start dying off gradually, and then so at the end of the day there's no connection here. What that means is the eye can send information to the brain cannot receive information from the eye and pass it down back to the eyes. Do you understand? So that is basically what glaucoma is. There's a constant death and depletion. It's just like there's like a circuit is being cut off. Okay, that is it. And the sad thing about this optic nerve death is the fact that the cells of the eye, the retina cells, the ganglion cells, and the axons. I'm sorry I'm using this grammar right now, but the cells of the retina, let me use that. They do not regenerate when they die off. As of now, although a lot of research is ongoing, right, to ensure that these cells regenerate, but as of now, right now, these cells do not grow back, they do not regenerate. That is why glaucoma is very, very dreaded, and glaucoma is one disease that we always advocate people to ensure they don't have, or advocate people to ensure they check their eyes, because when these damages happen, when the cells of the optic nerve die, they don't grow back. Okay, they do not come back up, they just die and pew, that is it. All right, they do not regenerate. Okay, there are some things that would happen to you, and you know they're happening, Okay, for instance, you have a cut on your arm, you know there's a cut on your arm, you know you have to do a lot of things to make sure that cut heals. You know you have to take drugs, you know you have to dress the wound until it heals. Okay, same thing applies to other cells of your body. If something happens, you break your thumb, break your hand and everything, you know that there's something going on and you have to treat yourself. But it's different with glaucoma. Okay, this is because at the back of your eyes we have 100% stock of nerves. Like the optic nerve, we can say that it's 100% full, a full stock of nerves. So now when this death starts happening, this nerve starts going off gradually, gradually, gradually. So let's assume that you have 100% stock of nerves and then 10% dies off. Okay, you are still seeing with 90%. So when that 10%, 15%, 20%, 25%, when these other nerves are dying off, you as a person who has this condition, you don't know that something is going on. You don't know that your nerves are dying off. Why? Because as 50% has died, there's still 50% that you are seeing with. So you really don't notice that something is happening. The point where you notice as a person that you are having vision loss or you're having severe vision issues is when like 80%, 70% of your nerves are gone, 90% of your nerves are gone. That's the point where you notice that, oh, something is actually happening to my eyes. All right, that is why we call it the silent thief. And the second reason why it's called the silent thief is because when these nerves start dying, they don't start from the central part of your eyes. Like now I'm looking at you, I'm looking straight into your eyes. Okay, if I am someone who has glaucoma, the vision loss starts from the side. Okay, so I could still be seeing very well here, my vision could still be 6.6 or 6.5, but there's an issue happening from my side. So this vision starts going from here down, 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 this way until you have just a little, you're looking through a hollow. We call it the hollow of vision, until the person is just looking through this hollow and then everything closes up and then there's total blindness, there's total darkness, right? So I'm sure I've been able to explain, I'm sure you understand everything I have been saying. I would say again, if you have not subscribed to my channel, do well to subscribe, do well to like, share with your friends and share with your family members. We still have a lot to talk about. Okay, now some persons usually ask me, my patients do ask me, doctor, why is it, what causes glaucoma? Like, why do I have it? What did I do? Is this because of something I did? Is it because of something I'm eating? Is it because I'm sick? What is the cause? Why do I have glaucoma? And it's a very simple thing. Pressure. The build-up of pressure in what? Your eyes. There's always this build-up of pressure in your eyes, okay? For you to see, now if I close my eyes, I can touch my eyeball, I can palpate my balls, right? Yes. So for your eyes to maintain this shape, there are fluids in the eye. There are fluids, like let me say water now, fluids inside the eye that helps it to keep that shape, that helps the structures of the eye inside to be healthy, okay, to be in the best of shape. Yes. So that being said, once these fluids build so much pressure in the eyes, they start causing they start impacting pressure again. They start leaning on the optic nerve, they start compressing the optic nerve. Let me use that word. I'm trying to be as basic as possible so that you would understand. I'm not giving this lecture for medical students or optometrists. I'm giving this lecture to the general public so that you would understand perfectly what's going on. Okay, so once the pressure in your eye is built up, it starts compressing the back of your eyes where the optic nerve is. And when there's a constant pressure that's pressing, it's going down, it's going down, it's going down, right? You know, there's loss of blood supply. Like, imagine something choking somebody choking, and then you pass out. Why did you pass out? For obvious reasons. So like I said, once this pressure is built up on your eyes, it starts compressing the optic nerve, and then you start having loss of blood supply, ischemia, and then these nerves start dying gradually, 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 gradually. Okay, so for some persons their pressure could be overboard. Usually the average pressure of your eyes should be between 10 to 21. Okay, 10 to 21. Some persons they will say 11 to 22, but 10 to 21 is the actual average of your intraocular pressure. But still, if your pressure is over 21, 25, 30, we've seen people with pressures of 60 and above, that's like a serious cause of concern. the nerve they start dying off gradually, and you wouldn't know, like I have explained before. There are also this group of persons who have normal pressure, they are within the average range of pressure, yet they have glaucoma. That's because that average is still too much for their eyes or for their optic nerve to bear. So the cause of glaucoma is buildup of pressure. Buildup of what? Pressure. Okay. Yes. So that has been said. The next thing I'll talk about is, why is glaucoma a thief? Why do you call it a thief? Most times when thieves come to raid a particular place, they just go there, pick up something, and fume. They've left. They are gone. Okay. You don't see them anymore. You don't see your item that they've collected. They are gone, gone, gone. Right? Yes. So that is why glaucoma is called a thief. It comes, takes the eyes, takes the optic nerve, eats it up, fume, and it goes off. It never comes back. Okay, it never comes back because the damage is what? Irreversible. Irreversible, like I've explained, the cells of the optic nerve do not regenerate, they do not come back. That is why they are irreversible, right? Yes. So the last thing I'm going to talk about is, how do you avoid glaucoma? How do you avoid the optic nerve death? How do you avoid total blindness from glaucoma? First thing is for you to have constant periodic eye exam. If you don't have constant eye exam, you will not know that you have glaucoma, especially at the beginning or at the intermediate stage. You can never know. You would not know. Okay? Except if it gives you symptoms, except if you have the closed angle glaucoma, which we'll talk about in another video. Closed angle glaucoma, which will give you actual pain and actual symptoms, right? But the open angle glaucoma, which it doesn't give symptoms, okay? So when it starts happening at the back of your eyes, you don't know. You are actually totally oblivious of what's happening until an optometrist or an ophthalmologist or a licensed practitioner looks into your eyes and sees the constant death and sends you for a series of tests to confirm it. That's when you would know. That's why we always encourage you, check your eyes, check your eyes, check your eyes all the time. If you've checked your eyes today, does not mean that next year you won't check your eyes. It does not mean that in 6 months' time you won't check your eyes. Check your eyes all the time. Secondly, make your optometrist your friend. Make your eye doctor your friend. Always visit your doctor. Okay. Third thing is adhering to your medications. There are people who lose their vision due to negligence. They've been diagnosed with glaucoma, but they're tired. They'll tell you, I'm not seeing the change. I'm tired. I don't want to take anymore. They neglect their vision, and then when the vision is totally gone, they start coming back asking you for solution. Please, how can I see back? Please, let's do surgery. Please do this for me. I'll pay any amount, and you can't bring the vision back. You can only beg them or advise them or send them to rehab so that they can manage the amount of vision they still have left. Okay, so heed to your medication and comply. Most people don't comply with their glaucoma medication. They don't comply at all. I'm sure it's because they do not understand what is going on. Because the purpose of glaucoma treatment is not to restore it can restore your vision, rather. The purpose of glaucoma treatment is not to restore the vision back to its normal state. The purpose is to maintain the amount of vision that you have once the management begins. Our next video, we're going to be talking about the different types of glaucoma and what you should look out for. Yes, and we're also going to talk about other things related to glaucoma. This is glaucoma week, so stay tuned to this channel. Okay, so I would like to go back and have a rundown of everything I have said. Before then, again, like, subscribe, and share this video. Right, first off, glaucoma is a silent thief of sight. Second of all, glaucoma is a constant, gradual, irreversible death of the optic nerve, and then the optic nerve is what connects the eyes to the brain. So if there's a cut or there's a deviation from normal from that, there is total vision loss. Total vision loss because the optic nerve does not grow back as of now. Research is still ongoing. We hope that they bring up something, that a medication or a procedure that can bring back the optic nerve. But as of now, as we speak, there's no regeneration of the optic nerve, so vision cannot be restored back, right? And it is a silent thief of sight because once you start eating up the back of the eyes, once glaucoma starts eating the back of the eyes up, you don't know, you're not aware until most of the nerves are gone. Okay, yes. And the reason for the death of this nerve is because of buildup of pressure. Yes, and I've also told you tips on how to avoid losing your vision. Like I said before, I am Dr. Onomuwe Ufoma Juliet. I am your favorite optometrist on the street of Instagram, the street of TikTok, the street of YouTube. virtually everywhere. And I would love to have a conversation with you, a consultation with you. So if you have issues with your eyes, you're having glaucoma, you want to talk about it with someone, I'll be here for you. So thank you for watching this video. See you in my next video. Bye.